Welcome to the Cincinnati USA Regional Chamber's Racial Equity Series. I'm Jill Meyer, the President and CEO, and I thank you for joining us. The Chamber has long prioritized inclusion in everything that we do, and we need to do more. Last week, we issued our endorsement for the state of Ohio, Hamilton counties, and the city of Cincinnati's impending resolutions to declare racism a public health crisis. Along with our endorsement, we are pushing for and committed to helping to bring about the actions needed throughout our community to address the inequities, both creating and resulting from this harsh reality. We also continue to prioritize our work already underway at the Chamber to address the insidious economic effects of racism. We continue to elevate and invest in the nationally leading work of our Minority Business Accelerator, our groundbreaking Workforce Innovation Center, and the array of programming in our Diverse by Design training and leadership offerings, like cultural competency for leaders. We're also adding new learning opportunities, like this Racial Equity Series, which is an extension of our Diverse by Design and Leadership Now virtual platform. These are strategies to reduce economic disparities that exist in our region as a result of racism. We see the stark current realities and understand the critical importance of creating inclusive workplaces, more minority-owned businesses, and more inclusive communities to help drive change. We believe that positive change is accelerated through education, tough discussions, courage, discomfort, and empathy. You do too. That's why you're here. Thank you for prioritizing your role in creating a more equitable Cincinnati region. We are grateful to BI3, Bethesda Inc.'s grant-making initiative to transform health, for sponsoring this series. And we're so happy that Bethesda Inc.'s president, Jill Miller, is here with us today. Thank you, Jill.
Thanks, Jill. BI3, Bethesda Inc.'s grant-making initiative to transform health, is proud to partner with the Chamber to bring you this Racial Equity Series to equip members of our business community with a better understanding of structural racism and the role they can play to build more diverse, equitable, and inclusive workplaces and cultures. BI3 fuels collaborations and partnerships to disrupt the status quo and tackle the social, racial, and economic disparities to achieve equitable health outcomes. This is going to take strong leaders like you in all sectors to create change. But I believe in a day when every Cincinnatian has equal opportunity to achieve their highest level of health and well-being. And I want to personally thank you for coming on this journey with us.
Good afternoon, everyone. How are you doing today? My name is Felicia Beckham. I'm a board-certified family nurse practitioner. I am also the president and founder of Cincinnati's Black Nurse Practitioner Network, and I serve as your moderator today. Today's discussion will be understanding health disparities and how your business can be a part of that solution. We are joined here by the esteemed panelists today. We have Ms. Renee Mahaffey Harris, Ms. Kiana Trebu, Ms. Jill Miller, and the esteemed Dr. Angelica Hardy. Welcome, everyone. Just some housekeeping things today. I would like to make sure everyone is on mute to reduce the noise, as well as make sure that we're interacting through the chat box. So any questions or comments you may have, definitely leave a comment or a question in the chat box. I would like to start to introduce everyone. So if everyone can have just take a brief moment to introduce themselves, I would greatly appreciate it. We'll start with Ms. Renee Mahaffey Harris.
First of all, thank you, Ms. Beckham. My name is Renee Mahaffey Harris, as you've said. I'm the president and CEO of the Center for Closing the Health Gap in Greater Cincinnati. And I guess I'm supposed to start my video. Not great with technology, but I'm really proud to be a part of this panel discussion to further elevate the conversation on health disparities that we have been addressing as an organization for over 16 years. COVID-19 put the light on the fact that Black people in this country were dying disproportionately and being impacted by COVID-19, and thereby really helping us understand the impact of health disparities in our country. So I'm happy to be a part of today's panel with such incredible other panelists who are experts in this field.
Thank you so much. Dr. Angelica.
Hi, everyone. Good afternoon. So I am Dr. Angelica Hardy. I am currently Vice President of Health Strategy at the American Heart Association, where we are working in Greater Cincinnati and Northern Kentucky, so all individuals can have longer, healthier lives. So I'm very excited to be a part of this conversation today.
Thank you. Thank you. Ms. Kiana Trabue.
Good afternoon, everyone. My name is Kiana Trabue. Currently have the pleasure of serving as the Executive Director of Population Health Strategies at the Health Collaborative, where I lead our Community and Population Health Initiative, which is called Gen H. I've been working in public health here in Greater Cincinnati for about 15 years. So it has been an interesting journey to continue to talk about addressing health disparities, and it's been great to see a lot of the work that has been done across those 15 years, involving a lot of the organizations that are represented on the panel today. So thank you to the Chamber for inviting me to be a part of this discussion. I think it's really critical to add that business lens to the discussion and help businesses and employers understand the role they can play in helping to address health disparities. I'd be remiss if I did not mention the beautiful village of Woodlawn, where I serve as a council member. So go Woodlawn.
Yes, thank you. And Ms. Jill Miller.
Hi, hello again, I guess I should say, since our organization is sponsoring this amazing series. But I'm president of Bethesda Inc., and we have a grant-making initiative called BI3, in addition to being the co-sponsor of TriHealth. So if we are going to achieve better health outcomes for everyone in our community, then it's going to take all of us. And so I'm really excited to have this conversation and lean in and learn from all of you, as well as hopefully contribute and challenge some thinking. So, and I'll just say it's a true honor to be on this panel with all of you amazing women.
Thank you. Thank you. So today we will define health disparities. We will also identify health disparities that are impacting the city of Cincinnati. We will also understand the importance of addressing health disparities in the business sector and how we can empower leaders to become change agents to contribute to this crisis that we're having. So we have to understand that organizational costs are impacted by health disparities. Where a person lives determines their health outcomes. If an employee suffers from uncontrolled a chronic condition, the organization takes a big hit. It can anticipate increased sick time, absenteeism, and medical leave, which all can encompass time lost, but also costing the organization money. So we have to understand that is the bottom line. Understanding that, looking at the Integrated Health Institute, they have quoted that U.S. employers pay $880 billion in healthcare benefits. However, illness-related productivity costs them another $530 billion a year. And that is because the employees are absent. So how can we prioritize the needs of the healthcare in the employee sector to make sure that they are knowing that their employees are supported by this demand of the health disparities? So I would like to start with Ms. Renee. I'm sorry. There are some questions that we definitely want you to think about throughout the session. So Spencer, thank you. So we'd like to know, I want you to understand, have you identified the common health disparities in your organization? What is your organization's contribution to the above dollar amount? Are you ready to lead your team to influence healthier lifestyle changes within your organization? Are you committed to the well-being of your employees? And what steps and actions are you going to take? So Ms. Renee, are you able to define and let us know exactly what health disparities are?
I am. Hopefully my slide pops up, but if it doesn't, health disparities, here we go, is the differences in the incidence and prevalence of mortality and burden of diseases amongst adverse health conditions that persist among Black Americans, Latinx Americans, and other minority groups in the United States. Next. So as we look at the issue of health disparities, it was about 35 years ago that Secretary Heckler did a study over 18 months. And what that study showed us, which I think is really important in this conversation, especially as we talk about businesses. Oftentimes people look at health disparities as affecting a potential economic group, but health disparities in this study show that regardless of your socioeconomic or educational attainment, your disparate outcome in comparison to your white counterpart was going to be worse. And so, then you look fast forward to 2016, the federal government's health quality study confirmed that we are in 2020, and in 2016, the study showed that the needle has yet to move as it relates to health disparities across our country, showing that Black people were greater than whites in this nation across socioeconomic factors in their health disparity, driven by the social determinants of health. Next. So that's the reason for the disparity, right? The reason is SDOH, some people refer to it that way, but it's our social determinants of health, all those quality of life factors we live every day. Those determinants of health are conditions in which where we're born, where we grow, where we live, where we work, and where we age. The circumstances are shaped by economics, power, resources at global, national, and local levels. The determinants of health are most responsible for the inequities that we see across our country. And those disparities go through every aspect of the quality of life that we all experience, as the World Health Organization has shared. Next. So let's look at the conversation that we are having in our country now. I really appreciate Jill Miller and your leadership, and as you talked about structural and institutional racism and structural and institutional factors that are contributing to health disparities in our country. So as we begin to kind of pull the onion back on social determinants of health, Black Americans have higher rates of hypertension, asthma, diabetes, and comorbidities of these chronic diseases. These higher levels of chronic disease are linked to the issues to our left. So when we think about or experience or have experienced or read about housing discrimination, as we think about what we learned some years ago in Flint with water, neighborhood proximity to toxic areas, as we think about the access and lack of access to healthy foods by food deserts, meaning you live in a community and that may be representative of over 24,000 people, and that community does not have a grocery store. That's how you define food deserts. It's about the population that are served by a full service grocery. Higher uninsured rates. So from a business perspective, this is really detrimental as we begin to look at the future of our country, in which the population shift will show by 2040 or 2050 majority minority. So as you then look at the comorbidities and structures that impact health outcomes, that is a really big factor that's going to contribute to the cost of health care delivery for businesses. And then finally, racism. And I just left a press conference that the city, and joined by the county, joined by the state, declared racism a public health crisis in our region and also in our country, as Senator Sherrod Brown has done with other colleagues. So we start looking at the psychological distressors that impact race, and then the correlation to that impact then to the health outcomes. We have a lot of work to do, and as the Institute of Medicine has shown us, is that we are going to need to work together to begin to dismantle the structural and systematic factors that contribute to many of the systematic factors that I've just described. Next. So let's talk about COVID-19, which is, something that we are all continuing to thank God that He is guiding us through this time. However, it is having a detrimental impact on all of us, but a more disproportionate impact on Black people. And so what this slide shows us is data, and data is going to drive how we change the outcome. So the Ohio Department of Health has a social vulnerability index, which I use that social vulnerability index from Chip Allen, who is with ODH, for us to begin to see in Cincinnati, if you layer the comorbidities and you also look at race across our Cincinnati census tracts, you see that 22,234 people are impacted disproportionately, will be impacted disproportionately by COVID-19. And then if you look at this chart more closely, you see that Black people in particular will represent 86% of the negative impact of COVID-19, specifically because of comorbidities. And so as our moderator shared at the beginning, she talked about the recidivism, we talked about the absenteeism, the cost of health disparities and health to businesses. This data becomes so important, and the solutions that are going to address these inequities are borne by all of us. And so getting to equality and getting to a justice in the issue of health disparities is everybody's business. Next slide. I think this is my last slide.
Okay.
So let's look at equality and equity. And so we hear these terms a great deal, and I think this graphic really describes what those differences are. So when we look at the individuals on the bikes, they all equally have access to a bike. But then we look down at the slide below and we look at the conversation on equity, the empowerment and resources needed to ensure that they receive what they need to have the right bike that fits, meaning live in the neighborhood that provides access to all that you need. But when you look at the bikes, they now have bikes that fit their need. So yes, equality is a part of the conversation, but addressing the empowerment and the activation of individual agency and having the ability to be met where you are to receive equitable distribution of what you need to live in America is really what I see in this slide. So we have a lot of work to do, but I know that together we will get there, and that it's going to take all of us to make that happen.
Thank you so much, Renee. That was very, very valuable. And I think that is eye-opening not only to the global lens, but also to our local lens that affects us each and every day. If everyone can turn their phones and background information or atmosphere on mute so we can hear it and really understand what the speaker is conveying, that would be great. So when we look at all of this, is anyone surprised by the information that is in front of them? Has anyone really taken a step back to actually look about what is impacting us in regards to the health disparities in our organizations? Any comments? Definitely utilize the chat box to identify any kind of surprising information that you may have. So when we speak about health disparities, anyone have a story or an example of how this impacts us in our daily lives?
Sure, I can jump in here. First of all, thank you, Renee, for all of that information. It really kind of set the foundation for our conversation and discussion today. So thank you so much. We're blessed to have your knowledge in the room with us. You know, as Renee talked about, I won't repeat everything she said, but I do want to reiterate a couple of points. When we talk about the structural and historical factors like racism, segregation, housing discrimination, poverty, and unequal and discriminatory practices and treatment in our medical system, those are really what cause health inequities, which are those differences in health status, and health inequities lead to health disparities, which are those differences in health outcomes. I think it's really important to, again, reiterate that point and make sure that everyone has that foundational understanding of how we got here. It didn't happen overnight, and so it's not going to be changed overnight, but it's going to take all of us kind of rowing in the same direction in order for us to get there. So one of the things I was thinking about in preparation for this conversation was a report that was put out by the Urban League of Greater Southwest Ohio back in 2015, A Tale of Two Cities, the State of Black Cincinnati. And actually the first report was released in 1995. They released another report 20 years later in 2015. Unfortunately, the reports were almost exactly the same. Renee mentioned earlier that there's not been much movement in trying to eliminate health disparities and to close some of these gaps. Her report talked about since 2016, this Urban League report lets us know that 20 years later, we're still seeing some of the same issues. These disparities that exist not only hold Black people back, but again, as Renee mentioned, it holds everybody back. There's this idea that a rising tide lifts all boats. So as we try to lift those that are suffering more than others, everybody benefits from that work. This also reminds me, and if you can look here on your screen, you see this citywide life expectancy data that came out from the Cincinnati Health Department, which shows really stark disparities in life expectancy across the city's 52 neighborhoods. There are tons of research out there that say that your zip code is almost the single most determining factor in whether or not you have the ability to be healthy. Which is quite interesting because when you think of all the other factors that we believe impact an individual's health, really it's your zip code, it's where you live. You'll see about a 25-year difference between individuals that live in Lower Price Hill, who have a life expectancy of 63 years, and then those who live in Mount Adams, who have a life expectancy of 88 years. So a 25-year difference in life expectancy across these neighborhoods that are only 5 miles apart. So there's not that much difference in the distance between those. These disparities exist, again, as Renee mentioned, because of those social and economic factors called social determinants of health. Another thing that I'd like to point out, in the community of Avondale, a white person's life expectancy is 92 years and a Black person's is 69. So not only do these disparities exist across these neighborhoods, but then also within neighborhoods. And obviously that last one that I talked about is a racial disparity and racial inequity. And so we really have to do the critical and intentional work to make sure that everyone has access to healthy food, to good jobs, to quality education, to quality and affordable housing. Essentially, those are all the things that prevent us from getting sick in the first place.
Absolutely. Absolutely. Thank you so much for that valuable information. Chat box, they are asking about the social determinants of health, that slide again. We can kind of go back there quickly, but we can also send this out afterwards in the email as well.
Sure. So just to add some additional context to that, those social determinants of health are those social and economic factors that impact an individual's ability to be healthy. So again, whether or not people have access to healthy food, whether or not people have safe and affordable housing, violence is a social determinant of health as well. Your social economic status, so your income, ability to access quality education, all of those things ultimately have an impact on your health. One example of that is whether or not you have access to health care. So if you don't have access to health care, then that obviously impacts your ability to be healthy.
Anyone, have you guys identified the health disparities in your organization? Does anyone have any insight to that? Has anyone even thought about that?
I can add, at the American Heart Association, we are in the beginning journeys, working with some other community partners to see how menthol has impacted our community, and specifically menthol within tobacco products. And we know the huge disparity with smoking cigarettes and how that affects your heart health, both in the short term and long term. And then now, as we talk about COVID and how we continue to do research and find evidence if that is a huge risk factor, which on a preliminary basis, we seem to be true, but it takes time. So we're excited to have some momentum in identifying how we help our neighbors really stop smoking, and then now we see menthol and other flavors happening with youth now with vaping. So we're kind of on a constant. It was interesting when you said they did that study in 1995, and I was thinking about tobacco and that like 20 years ago, we were saying stop smoking, and we did such a great job in the last 20 years. 20 years later, less people are smoking cigarettes, more people are smoking electronic cigarettes, which they seem to be safer. So it just made me think of like thinking back, we probably can couple that with all of the health outcomes and health concerns we've had over the years to see what differences we've made.
Absolutely, absolutely. So now it seems as though that we have resolved some, but now we have new sets of issues or challenges.
And still have disparities within those new ones as well.
Right.
Absolutely, absolutely.
Felicia, if I may add, as co-sponsor of TriHealth, TriHealth is doing a lot to look at the health disparities. So although healthcare is only 20% of a person's health equation, there's a lot we can do inside our healthcare system to achieve more equitable health outcomes. And the Greater Cincinnati Foundation has actually afforded the opportunity for local healthcare systems to train staff to make sure that we're capturing race, ethnicity, and preferred language so that we as a community can really start to look at the true health disparities and what we can do about them.
Absolutely, absolutely. So, Jill, do you have any insight in regards to different initiatives or plans or strategies to help support those?
Yeah, so TriHealth, I can only speak for TriHealth because that's where I'm involved. But we're looking at both where are the top health disparities within our different service lines, whether that's women's services, the Cancer Institute. But this is going to take minds and hearts. And so TriHealth is going to do a lot of work internally through cultural competency training, implicit bias training, really engaging top down, sideways, and bottom up around how we create a better culture for everyone and our patients and ensure that the patient experience is equitable and that every patient receives the quality of care and treatment that they deserve.
Absolutely, that's definitely on the forefront. We do have a question. So first, you talked about the difference in neighborhoods as far as life expectancy. Then you said how much longer a white person might live in the same neighborhood as Black. Please clarify. Anyone like to answer this?
Sure, that was kind of what I talked about. So I think that's a great question. So thank you for asking that. Differences by neighborhood, really when you start to break down the demographics of those neighborhoods, one of the determining factors is socioeconomic status. So those neighborhoods that are in where folks are more folks are living in poverty have lower life expectancy. In addition to that, those neighborhoods that are food deserts, as Renee talked about, also have lower life expectancy. When we talked about the neighborhood of Avondale specifically and thinking about a white man who would have a life expectancy of 92 versus a Black man having a life expectancy of 69, the first thing that popped into my head to really explain that disparity or that difference is around racism. It's a racial disparity. Racism causes lots of stress in an individual, which can obviously impact their health outcomes, as well as talking about things like segregation and access to housing and all of those things, which disproportionately impact Black people and people of color. So that is really what explains that difference between the white man living to 92 and the Black man living to 69. It really all comes down to this root cause of racism.
Thank you, Kiana, for answering that. Jill, can we talk about how health disparities affect the economy and the business sector? And then also, what can business leaders do?
Thanks, Felicia. I think as we're learning today, health equity is an economic issue as well as a social justice issue. And, it's simple, right? The business case is relatively simple. Health disparities lead to higher direct healthcare costs as well as indirect costs, as Felicia mentioned, through absenteeism, increased turnover, decreased productivity. And we're talking big numbers. So Harvard Business Review reported that racial health disparities are associated with nearly $250 billion direct and indirect expenses for our nation annually. And addressing this is going to be critically important as our population becomes more diverse. And in fact, by 2050, people of color will make up more than half of our population. It's estimated around 52%. So the question I land on is, if the economic case is so strong, and it's been strong for years, why did it take the death of George Floyd to get these conversations going? I want to bring health disparities a little closer to home for you and give you and your businesses a few things to think about. So first, I'm assuming many of you or your organizations offer health insurance to all of your employees. But as you've heard today, that doesn't mean that each of them have equal access or equitable care. In fact, employers invest a lot of money in a healthcare system that doesn't always provide equitable care and equitable health outcomes. We've learned through our work at BI3, especially in the maternal and infant health space, to Kiana's point, race is a predictor of outcomes. And it's a predictor of outcomes when you're talking birth. A Black educated woman has worse health birth outcomes than a white woman who has dropped out of high school. So a lot of people like to say, but one had more education or one is higher income. Well, look no further than the story of Selena Williams and her pregnancy that she recently had and how she was treated as a patient. So what can you do when your health plans come up for renewal? Ask the hard questions of your health vendors. How are they identifying and addressing health disparities? How can they help you create a healthier workforce? Another question I'll challenge you with is, have you examined your internal policies with an equity lens? For example, do you provide paid sick days? More importantly, do those sick days start on day one? What the Women's Fund has found is that women, especially if they're single parent households, can't predict when their child's going to be sick. And so, you know, being able to care for one's family, a woman should be able to do that without worrying about lost income or worse, losing her job. And this is a fundamental health issue that we as employers and the business community can start to address. And the Women's Fund has an employer toolkit that I encourage some of you to check out as you look at some of your internal policies. But let's get to the heart of the matter. It begins with you. Your willingness to do the hard work and examine your own heart as a leader. Learn more about structural racism. Lean into the hard conversations. Get comfortable with being uncomfortable. How often have you thought about everyday trials and tribulations of your Black colleagues? The trials that they face just because their skin is Black. A dear friend of mine recently shared with me, we've had some great conversations. He shared that before he enters into a conference room or meeting room, he pauses to think about how he can enter into that room so that he does not appear to be an aggressive Black man and worries about how he will be perceived. I don't do this, and it's something that I've been blinded to. I worry as his friend what this everyday stress will have on his long-term health. What I'm asking you to do is not easy. Admittedly, I'm a 40-year-old white woman who has had many advantages in life because my skin is white. But I am committed to being a student of health equity and an anti-racist. I now realize that my own colorblindness in the past, that race doesn't matter, that I treat everybody the same, has actually blinded me to how it does matter in everyday lives. I encourage you to check out the book White Fragility that was written by a white woman to talk with white people around how and why it's so hard for us to talk about race. She wrote it for people like me, an average, well-intended white person who sees herself as open-minded, and yet someone who could not answer the question, what does it mean to be white? So as we talk about this and why businesses should care, I challenge you not only to speak to minds, but to address the heart as well if we're really going to make a difference.
You know, that was very impactful, very touching, and very moving. I think that was very thought-provoking, and I think that was a great conversation to really get this this conversation started. So I truly appreciate your candor, but also just the thought-provokingness of your comments. So thank you so much. Would anyone else have anything to add?
I would like to just comment, thank you, Jill, for your open and honest conversation. And it's going to be that type of trusted conversation between each other that is really going to enable us to do what we all want, which is to ensure that everyone has equity, equality in our lives and every aspects of our lives. So thank you, Jill.
Anyone else?
I echo that, just to say thank you, Jill, not only for the work that you're doing along your personal journey, but then also bringing that into BI3 and into Tri-Health as well. It's very brave of you to be as vulnerable as you have been. And I think that this is a good model for how to have those tough conversations and be anti-racist. And, you know, I would just add to what you stated before is just be open to learning something new and be open to really dismantling and destructing everything that you may have been taught before, and really starting this journey with a clean slate, and being open to learn from others that you may not have the opportunity to learn from otherwise.
Thank you, everyone. So now we have identified what health disparities are. We have identified how it impacts the city of Cincinnati. And then also we've given examples of different initiatives that you guys have conveyed throughout the conversation. So what can businesses do now? How can we give them the tools or resources that they can take along this conversation and actually implement it into their business?
Yeah, I can take that. And I think Jill definitely teed it up perfectly for me to kind of give a ton of info that will be sent out. There's going to be a curated list of resources from podcasts to books. I mean, basically however you can get your entertainment or your knowledge, all of that. So I think there's two ways, and I think Jill and Kiana and everyone kind of mentioned it already. It's what you're doing personally, and then what can you bring to your organization. And so often in the last month or couple months, we've like, which comes first? And I don't think we can tell you that. Everyone's at a different journey, a different point in their journey. And it may be, I'm picking up my first book of how to be anti-racist, or it can be, I know a lot and I want to learn more. I'm ready to dive into how housing has played a role. I'm ready to figure out how food has played a role. Or it may be, I'm really not even understanding how we got here. So I think there's that figure out where you are in the journey, and then how do you become an ally? How do you bring that to your organization? How do you speak up and say, this isn't right at the table? And then challenge your organization as well. So it all depends on where you are within your organization, and not in a leadership role either. I think that's really important, because some people, I'm not in a position where I feel like I can change. And I think it's so important that we empower everyone to be allies in this work, and then also make sure that everyone has a voice to make a change, and then have the resources within those organizations as well. And I think the work that's being done at the Chamber, I know Greater Cincinnati Foundation has the Racial Equity Matters, which is a great resource. I've personally been through it, and they're continuing to offer more and more sessions now virtually, since we can't meet in person. But those type of things you can go through together. I think there's also an opportunity, if you want to learn more for your organization, to do that in a further deep dive. But I think it's on both ends. It's what can I do as an organization? And then what can I do as an individual? And then how do I bring what I learned as an individual back to my organization to be really an ally, thought-provoking challenge, ask those questions, and really get the work done. Because it's not just learning, it's now what am I going to do with this knowledge and when I go forward. So some of my personal favorites are some podcasts. I don't know if anyone has heard of Code Switch by NPR. It's one of my favorites because it has like videos attached to the word. So sometimes I want to be listening, sometimes I want to be mentally stimulated. So there's all different types of things you can do, as well as Stamped from the Beginning is a really good book. There's podcasts, there's a 1619 podcast. There's Brene Brown also has a series. So there's going to be a curated list sent to you after this. But I really encourage all of you to utilize these tools to just go on your personal journey, but also take that knowledge back to your organization.
Thank you, Angelica. Does anyone have anything to add?
I did want to add something. There was a question that popped up around someone said that they heard an excellent presentation some time ago about the fact that everyone has biases and how important it is to understand those biases. So I wanted to just mention as another resource and something that you can do as an individual, but then also bring to your organization is Harvard University actually developed an implicit associations test that you can take that will help you to identify your biases. So it is true that we all have these implicit or unconscious biases. And it's important for us to recognize those and understand those, but more importantly, we need to pay attention to how those things show up in our everyday lives and our everyday interactions, both with our family, our friends, and then most importantly in the workplace. So we can make sure we include a link to that implicit bias test in the materials that are sent after this event.
I think that is very.
Also, add to that, Kiana, what do you think about having someone facilitate those conversations after? I think that's also really important too, because when you have those conversations, it may be uncomfortable, or I think it's also really important to have a facilitator, even that being, if you have a diversity, equity leader in your organization or someone that's able to really figure out how we have those conversations, how we establish change, because what we don't want to do, and kind of with all these resources, is just do the test, figure out, but then what are we going to do about it? So I thank you for adding the test, because I think that's really important, having like an internal audit of what this looks like, what are some policies that can change going forward.
Yeah, absolutely. These are tough conversations. They're difficult. They bring up a lot of emotion and sometimes some trauma in individuals. So it's always good to have someone there that can serve as that neutral party to help facilitate those conversations and keep them moving in a positive direction. So absolutely.
Thank you, thank you. So does anyone have any consults that can be provided in regards to any kind of local organizations that may offer this business or this service to businesses?
So I can add that More Inclusive Healthcare is working with the healthcare systems to capture better data, but also developing online learnings. And they're going to also tailor that to other businesses. So create kind of different cases that people can kind of dig into. Check out More Inclusive Healthcare. I think they're going to expand some of their products to serve the business community at large. And there's a lot of different consultants in town. Vincent Brown is a dear friend and he's amazing. I think all of you are familiar with Vincent, and Janet Reed. I mean, they do an amazing job as consultants in really getting an implicit bias. But again, I don't want to, someone mentioned Planet Now, Tommy Lewis. I mean, I don't want to pick and choose, because I think that they're all wonderful in their own right. And it's just finding the right consultant for where your organization is at and what you're looking to do.
Absolutely, absolutely. So it's always good to give insight and always to give options. So some people may not know. So, those names could be of service to any organization out there. All right, so looking at ideas. So what can, concrete ideas that businesses can do? What do you think? Any suggestions?
Start now. Or if you didn't. No, seriously. I mean, the idea of, I think there's always an important to start with trust and identifying what that trust looks like within your organization. I think after the civil unrest with George Floyd and everything that's going on in the world, there was, as we mentioned, emotions and everything, but how are you genuinely talking about it at work? Because saying, oh, well, what are we doing now is not right, in my personal opinion. I think it's how are we addressing, I focus on health, but in health, what are we doing in our work and how are we going to change? And I think having a needs assessment, internal audit, whatever that looks like, and then saying, how are we working on ourselves internally before we decide to have a new initiative externally if we aren't doing the work at home. It's kind of how I think. So when I say start, it's a multi-layered, but I think we can't just, everyone immediately had a new initiative and this and that, but it's like, we were already doing this work before. And now we want to talk about how we can help others in that same journey. So, I mean, same with the chamber that was doing this work prior to this. And now when this series came out, it was perfect to have these conversations, right? Because these conversations were happening internally and with partners and businesses before. So I think that's really important.
I wanted to jump in. I like the fact that you said trust, because all of this begins with trust, and in healthcare, it's about trust. And so I don't know that this is something that I can speak to from experience. I did live in the corporate world in banking some decades ago. And so what I do know is it does have to start from the top. And so we're in a really interesting time in our country right now. And so I was talking to a friend who's a senior leader at a insurance company in Texas. And he was telling me that his senior leadership are having these round table conversations that involve diverse people in different positions, where it's a safe zone to talk about what you really feel. That means, things that you might just say to each other that look the same race-wise, but being able to be in a safe space to say, here's how I feel when. And it maybe it's been directed at a person, but I thought that was really incredible that was coming at a senior level, because then it starts to break down the culture. And no, we're not going to change the isms and racism in our nation overnight. But I think when we can have trusted conversations over time and feel that we're in a safe place to have them, because we all have the same emotions, and that's the reality, Black or white or any other ethnicity. But until we can get to that place of being able to trust that I can say this to you and that there's not going to be retaliation, it's not going to affect my ability in the organization, that when we can do that, and I agree, the REI and all of those things that expose us and help us understand, which is the step one, right? And so I don't know what that looks like in different organizations, but I definitely applauded what I saw at this insurance company and their senior leadership taking that leadership to engage in that depth of conversation. We have had a lot of incredible things happen to us in a short time frame.
Absolutely.
With COVID-19, with George Floyd, Breonna Taylor, and just being confronted with the fact that this is about race. We have to be patient and give grace to each other.
Absolutely.
Like incredible grace. And I was at a car wash, and I'm not going to talk too long, I promise. And I was standing next to a police officer. He was getting his car washed, and I looked at him, we spoke, and then I looked at him, I said, you know what, thank you for your service. Now, there is a part of me that is unhappy about what I have seen in this country relative to Black men and Black women being killed at the hands of police. However, the reality is that the humanity that exists within anyone providing a public service is real. And so and just as Black people are not monolithic, what an action of one person does not indict the entire population of officers. But there are some systems and structures that we now know need to be looked at differently. But being able to have a safe space to have those kind of conversations, and because we may have different extremes of what we feel from our own history, from our own experiences in our families and neighborhoods and our social interactions with individuals. So I didn't have an answer, but I think that somehow those type of conversations have to evolve in a different way than they are today.
Absolutely.
Yeah,
Thank
and I
you
would
so
add,
much. Yes.
I was just going to add really quickly, the other thing the word that came up for me, trust was one, and then commitment was the other. So as an organization, how are you showing that you're making a commitment to equity within your organization? How does equity show up in your strategic plan? How does it show up in your policies and procedures for your organization? How is it showing up in how the work that you're doing is being measured and how data is being captured and shared out? And then also on the individual employee level, how is equity being integrated and ingrained into your performance metrics? And so those are some additional ways that you can ensure kind of that top-down approach, that the organization is going to make a commitment to this, and this is how we're going to do that. What kind of resources are you willing to put up to focus on this work?
Thank you so much, Kiana. Thank you so much, Ms. Renee. Everyone has been great. Just want to actually read a couple comments from our chat box. So social determinants of health is where the focus needs to be, extremely valuable information. Also, they're saying thanks to Jill in regards to her honesty and vulnerability. Also looking at the Code Switch. They love that podcast, Dr. Angelica Hardy. Also looking at it, let's see, awaken is another word that they wanted to emphasize as well. So as we are kind of coming close to home, it's actually almost time to wrap up. But does anyone have any closing thoughts or comments or desires or just something they want to leave with this discussion?
I mean, I'll jump in here and just say that, in addition to the financial business case for doing this work, as we've pointed out, social determinants of health is a huge, where you live, play, work. So we're all a part of this. The environment you create in your workplace and the care that you put into understanding where your employees live and the zip code that they live. Wellness programs are great, but it's not as simple as sometimes eating healthier or going for a walk at night if I live in a place where I don't feel safe and I don't have easy access to healthy foods. So, we got to change hearts to change behaviors, and behaviors change systems.
Thank you so much. Anyone else briefly?
Sure, I'll just say, thank you to the participants for participating in this conversation today. There's probably plenty of other places that you could have been, but I think that the fact that you showed up and wanted to engage in this conversation is a step in the positive direction. So I would encourage you not to leave this conversation here, but to continue participating in these conversations, continue learning, continue asking questions. I know that there's going to be information that's going to be sent out after today, but I would be happy to share my contact information if anyone wants to ask some additional questions or have some additional discussions around these topics. Definitely not an expert in all areas, but would be happy to engage with anyone who's willing.
Thank you so much, Ms. Kiana. Anyone else briefly?
I'll go really fast. I just want to thank everyone as well. Ditto. And I think I would say my call to action would be take something from the resource, either a book we mentioned, a podcast. If you are in the beginning of this, be that your first thing, or if you were closer to working through it with us, what am I going to challenge my organization to do next? And when I say challenge, that means empowered. I don't see challenge as always a negative. You want to challenge and make your organization and yourself in this world that we live in, as we talk about live, work, and play, better. So please take that as a call to action.
Absolutely.
And I just really very quickly just want to say thank you to you, Felicia, as our moderator. Thank you to BI3 and the Chamber for hosting this series and conversation, which is just a beginning of the conversations that we must have. And, most importantly, we each have a step to play and a role to play in how we reshape and become anti-racist in actions, practices, and policies in business and in our communities. And so I thank you for really engaging in this conversation to take this first step. So thank you.
Thank you so much. So again, I'll leave a question is to the organizations out there, are you committed to the well-being of your employees? And what steps will you take? So I want to say thank you again to everyone for this conversation, for the interactions. As we mentioned, there are a number of resources, steps, and initiatives that you can take along your journey, wherever that may be, but just continue. It just takes one step to move forward. So I thank you, everyone. Also, thank you to the Chamber. So I thank you for actually creating this platform to engage in this dialogue. So I truly appreciate your innovativeness to move the needle forward with this. I would also just turn it over to the Chamber, Ms. Beth McNeil, and she would take over from here.
Terrific. Thank you, Felicia, for moderating such a dynamic panel. Thank you to Kiana, Angelica, Jill, Renee, for sharing your time, your passion, your authenticity, and your expertise with us today. Great discussion. And a special thank you to Jill and BI3 for sponsoring this series, and BI3, Bethesda Inc.'s grant-making initiative to transform health. Nice job, ladies. So what I heard today, trust, grace, commitment, and thank you for all the resources. So please come back to the Chamber's website to check out the resources that were shared today and any answers to questions that were provided as well. We're happy to share that virtual programming like this one is one of the many benefits of Chamber membership. And going forward, this series will be available free to members as a benefit of membership, and others who are not members will be welcomed for a modest fee. So I'm glad to share that we're currently launching a membership campaign with a variety of incentives and benefits. And one such incentive, if you're leaving the conversation today and thinking about what can I do, one incentive is the opportunity to give the gift of business. So individuals or organizations, companies can gift a membership to an MBE with 20 or fewer employees. So MBEs, WBEs with 20 or fewer employees can be gifted a membership that will last all the way through 2021 for only $400. So that's the remainder of this year and all of next year for the investment of $400 to gift membership. So we hope that you would please consider that as a way to get involved and stay present in the conversation. And if you're thinking about membership, additionally, members have access to a wide range of cost savings programs. And our members have saved up to $22 million in group buying power through these partnerships. And some of our partners include Humana, Office Depot, Shakely, just to name a few. And we're proud to have these 11 partners provide services to help our members with their business costs and efficiencies. If you are interested in learning more about membership or just expanding and getting engaged with your membership, if you're wondering, well, what else does the Chamber do besides virtual programming and how do I get involved? Please reach out to my colleague, Monty Taylor, who's our membership development rep, and Monty can be reached at 513-686-2945. Again, please reach out to Monty to figure out how to get engaged or learn more about membership at 513-686-2945. So thank you again from everyone at the Cincinnati, USA Regional Chamber. We're glad that you tuned in today. Please come back next week for session 3 of racial equity, which you see listed here. And when we sign off, please make sure to wear your mask. Stay safe, stay connected, Be encouraged with everything you heard today, and be well.